Hello everyone, this is Nurse Lizzie and I'll be talking about birth preparedness and complication readiness. Birth preparedness and complication readiness. Please note that birth preparedness is all encompassing. So as a pregnant woman, you should be able to make some plans for the D-Day. You should be able to know the nature of delivery you are going to go through. So birth preparedness is all about you planning for a normal delivery and for a case of emergency. You know, labor is like a coin. You understand? It has two sides. It can be progressing normally, all of a sudden some complications set in and there's a deviation. Maybe the woman was already dilating well, all of a sudden she doesn't progress again, or the baby was positioned well. As labor continues, the baby, there is a malpresentation or malpositioning that will entail them being taken in, the woman being taken into the theater. So you must be able to plan for a normal delivery and a case of emergency. So I'm going to be mentioning some of those things that the pregnant woman should be able to put in place for her delivery, the D-Day. Okay, as a pregnant woman, first, when you confirm that you are pregnant, what you have to do is to identify a health facility where you have a skilled birth attendant, a doctor, a pediatrician that will be there on the D-Day, so that if anything happens, they'll be able to help you and save the life of your baby and that of yours too. You should be able to know the date of your delivery. Some women are funny. They'll say, I don't know when I'll be due. That's why when you go for antenatal clinics, they'll send you for a scan. They'll ask you for the last time you saw your menses. From there, they'll be able to calculate and know your expected date of delivery. So you too should have a knowledge of that. Another thing you should look out for as a pregnant woman regarding birth preparedness is to identify some support people. Like in the aspect of transportation, say you're not mobile, let's say you're not mobile, okay, and labor can happen any time of the day, probably in the night, you don't know when it will happen. So you can go to a trusted person who is mobile and say, please, around this so time, I'll be needing your help in regards to transportation, so that when this happens, you'll be able to convey me to the facility where I registered. Support persons also in the sense that if you're a mother already, you have other children, when you're in the hospital, you are sure that your children and other family members are well looked after. You understand? Support people also in the sense that financially they are there to assist you in case of emergencies. You understand? So another thing you should be looking out again for in regards to birth preparedness as a pregnant woman is provision of funds. You should be able to set aside a particular amount, some money for your D-Day, that's the day of delivery. You and your husband should be a joint plan. You understand? I heard of a story, or we heard of a trending story some weeks back, where a woman lost her life when they went to a facility and they were asked to deposit some money. Actually, I'm not on a table to judge. No, I'm no judge at all. But the pregnancy is not just a sudden occurrence, like it just happened now, you're putting to bed. When you confirm you're pregnant, you should be able to start saving from that period to your D-Day. You have about 9 months to save up for. You understand? So you wouldn't blame some private facility when they say you have to deposit some amount of money, because most of the money, whatever they are using to pay their staff, is generated internally